Hey everybody, if y'all don't know me, my name's Paige. I'm an at-home student here at Sky CTC, and I decided that I'm going to go over the subject of psoriasis. So, for those who don't know, psoriasis is an autoimmune skin condition that currently has no cure to it. So what psoriasis is it develops by a rash. It's really dry, itchy, sore, and painful to the area. So most of these places that is going to be affected by psoriasis is going to be along your hairline, behind your ears, and on all of your joints. And basically what psoriasis is it is your body attacking your skin cells. So whenever you fall down and you get a cut, a rash, a scratch, some sort of wound, or like even an insect bite for this matter. So basically what it'll do is when your body is going through mitosis, it's going to have rapid cell growth. So it's going to have raised up, itchy spots where it almost looks like dry skin. And it's considered a scale, not like a mermaid scale, but it's considered a silver scale because it is uplifted. And of course, you cannot get it from contact with other people. It's not going to be oh my gosh, she touched me, she had psoriasis, I'm going to get it. So either you're born with it or you can develop it over time. It is more likely to get it if it runs in your family or if it develops and stuff like that. So one of the first signs of psoriasis is going to be the rash that'll form on the skin. It can vary in color. It's going to be dry. It's going to be a dry patch of skin that's going to be scaly, itchy, maybe some small bumps because it's a different type of psoriasis. Another beginning symptom is going to be dry, cracked skin that has a high possibility of bleeding because it's so dry and cracked. Psoriasis is a long-term skin condition that can sometimes have no symptoms, or you can have mild symptoms or severe symptoms. So basically with psoriasis, since there is no cure, there are of course things that you can do that's going to improve it. So all it takes is just one flare up from having no symptoms whatsoever of psoriasis to having the most severe case that there is, where it covers 90% of your body. So there are 8 different types of psoriasis, such as plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, erythrodermic psoriasis, psoriatic psoriasis, nail psoriasis, and scalp psoriasis. So plaque psoriasis is the most common psoriasis because it is basically skin growing on top of one another, and it's considered plaque. So the plaque psoriasis is covered about 80 to 90% of all psoriasis patients, rather than the pustular is basically pus that forms within that psoriasis cell. Psoriasis affects about 2.2 to 3% globally and about 8 million people in the United States. So one of the causes of psoriasis is maybe you have an injury, an insect bite, you consume an excess amount of alcohol, smoking, hormonal changes, especially in women, whenever you start puberty, whenever you're going through an encased part of puberty, such as menopause, or you get pregnant, you're lactating, any boost or change in your hormonal display is going to affect psoriasis. So medicines like lithium or anti-inflammatory drugs or blood pressure medicines can also cause a spike in psoriasis. Other immune disorders and stress, that's a really big one because it seems like a lot of people have been stressing out lately, and that can cause psoriasis to flare up. So stress, cold weather, dry weather, weight, and infections can cause the condition to worsen and spread to other areas. So if you just have psoriasis on your elbows, per se, if you're stressed out a lot or your weather and stuff like that gets really bad, because skin changes all the time. Whenever it's warmer weather, your skin's probably going to be either more dry or it's going to be more oily because your body's going to produce more oil. So diagnostic testing for this, psoriasis does have a very significant look to it. So if you go to your primary doctor's office or to a dermatologist, they're probably going to be able to look at it and diagnose it. So there are some similarities between psoriasis and eczema, especially with the location, how it looks really dry. So in that case, if they don't know whether or not it is psoriasis or eczema, what they can do is they can do a skin biopsy. So a skin biopsy is conducted by a dermatologist at their office. So what they're going to do is they're going to remove a piece of small tissue from that psoriasis eczema area, and they're going to send it off to a person that'll read the biopsy, and then results and stuff like that will come back, and you're probably going to have a stitch or two in your arm because they are getting a small sample of that. Psoriasis cannot be treated or cured, but it can be treated to control the condition. So once you have psoriasis, you're always going to have psoriasis. It's not going to take a cream or an ointment or something like that to just magically make it go away. There's always the possibility of the reoccurrence where it's going to come back from the next wound that you get. So the treatments can clear the skin and to get rid of the patches that are on your skin, but it's not going to prevent the flare-up. It is easy to clear up skin, but once there's trauma to your skin, the body's going to fight and build more skin cells and cause that plaque psoriasis to come back. Treatments do fall into 3 categories that can help with the condition, such as topical creams, ointments, because they can moisturize the skin, phototherapy, where skin is exposed to different types of UV lights, especially the UVB light. So basically that's where it penetrates the skin, where the skin is exposed, and it's to slow down the growth of skin. So steroid cream and ointment purposes is to increase the body's response to inflammation, and that it's going to decrease the itching and get rid of the discoloration of the skin. So all types of psoriasis are treated the same way with creams and phototherapy, and they recently have gotten into a pill. So a diet at home, if you change your diet, it's not going to prevent psoriasis. It's not going to change the fact that you already have it. But what you can do whenever you do clear up your skin is you can stop drinking alcohol, stop eating foods with high sugar, refined carbohydrates, trans fat. Basically, if you do have psoriasis, it is best if you eat a lot of fruits and vegetables, whole grains, and a lot of lean protein. So the prognosis is a benign disease that includes flare-ups. There is no cure. It requires lifelong treatment and upkeep, but not everyone has to do those treatments. Some people with psoriasis also have excess mental stress, anxiety, low self-esteem, and depression. People with psoriasis are more likely to develop these symptoms because they are insecure about what these patches look like, because it can cover most of your body. So it really does paranoid them. So my experience with psoriasis, I have a 21-year-old sister that was diagnosed whenever she was 16, and it covers 90% of her body. And watching her grow up and see how her self-esteem really went down after that, it really opened our eyes, and I wanted to learn more about this disease, not only for me, but especially for her, just so I can kind of know what's going on, and if there's any way I could help her, that I could help her. And I've really learned that the hard way. No one in our family previously had it, but the one thing that we are doing is we're just making sure her skin is super moisturized so it's not so painful. We're putting tons of creams, ointments on it to help with the inflammation on it. But there is no known cure to this, and the autoimmune